Zambia. Um, Especially with Namibia's good news of like women's presidents, women vice presidents, and a lot of women representation in the cabinet as well. So that's great, but we can't just stop there. There's still so much to do. There's still so much to talk about. There's still so much gaps, especially across the continent. So this is a great time to be speaking about policy and practices. And so, yeah, welcome. And welcome to the exciting conversation. So, if you don't know about Digital Health Africa, where have you been? But I'll just share a bit overview of what we do. So, Digital Health Africa was established in February 2023 and incorporated in Rwanda as a youth-led non-profit organization. So, what we aim to do is leverage media and publication strategies to drive positive change in the healthcare landscape across Africa. So we've been able to do that through disseminating information, fostering dialogues, and just really catalyzing action to improve healthcare outcomes on the continent. And we have 60 volunteers from across the African continent as well: Kenya, Nigeria, Zambia, Ghana, Tanzania, Uganda, and Zimbabwe. So it's really nice to like see the representation from the call as well. And that's why I really wanted to know where people are joining from as well. So our mission really is to promote the digital health agenda in Africa by improving access to information and community engagement as well. And you can see the lovely picture of the founder here, one of the member here, and that's me by the right, the policy lead for Digital Africa. So really, this event, what are we aiming to talk about? I think for me, especially coming from a policy background, I know how policy people, we love fancy documents. We love to have 250-page policy document explaining lots of fancy terms, terminologies. So really, this conversation is how can we really highlight that gap between policy and practical healthcare access? What are the people we talk a lot about people, women, marginalized populations, diversity, inclusion in digital across all policies, especially across African continents as well. But really, who are reading this policy documents? Are these policies translating directly into practical healthcare access? Are we showcasing the different innovative approaches that can actually improve equity in health? Do we have really good case studies from different continents that we can actually learn from, and especially even within our own continent as well? How can we amplify community-led solutions that can actually bridge healthcare disparities? And also, how do we empower all our key stakeholders with really actionable strategies and not really just paper policy documents that are actually written? What can be actionable from this policy? So really, this is a very, very important conversation, and there's no right time to have this conversation than now. So yeah, and I'm not going to be talking alone. You're not going to be hearing my voice all the time. I have really amazing women who are actually doing great things across the continent, especially within the landscape of digital health and healthcare. So first in the list here is Akinsoye Tomiwa. No, let me pronounce that right. I don't think I did. Um, so Akinsoye Tomiwa, yeah, I'm from Nigeria, by the way. So, exactly. So I'm like, no, I can't Britishize your name. Anyway, so I'll just read a brief profile of Tomiwa. So Tomiwa is a bright light and I'm sorry, and dedicated professional with leveraging digital health technologies to enhance health outcomes for children, youth, young people in sub-Saharan Africa. And at Farm Access Foundation, she leads the organization's digital health agenda, utilizing mobile technology to improve healthcare and public health outcomes. So she managed the mobile application for tuberculosis screening projects, which has enabled TB screening for over 3 million individuals and case detections, especially across underserved regions across Africa. And also she oversaws the Farm Access Health Remits project for beneficiaries in Nigeria. So it would really be of, yeah, see the great profile that we brought along to actually discuss this really important conversation. And hi, Tamara, can you say a few words and then I'll move on to the next.
All right, thank you so much, Taffy. Hello, everyone. Good morning, good afternoon from wherever you are. It's a pleasure to be here. And no, you didn't murder my name too much, Taufi. So big up to you on that note. So yes, like I said, it's a pleasure to be here today for this event organized by Digital Health Africa. And yes, I'm looking forward to our conversations, and I hope that it's a very collaborative and trust that to be an interesting event. So thank you for having me.
Thank you, Tomiwa, for joining us and bringing all of this expertise on board today. So the next person would have here as well is, sorry, I don't know what's wrong with my screen, but can you guys still see my screen? Um, just trying to. I'll probably just stop sharing and share again. Yeah, think you should be able to see my screen now. Hi, Tomo, can you see my screen? And is it really working from your end? Because it's freezing on my own.
Yeah,
Um,
I can see it, but it still has my
your
bio that
profile, right?
yes, that's correct.
Okay, I'll just stop again. Sorry about that. That's just one of the beautiful part of using Zoom for meeting calls. Anyway, what I try to fix why the screen is holding on just one page and letting our beautiful Tomiwa remain on screen. I'll just probably perhaps go ahead and share the other panelists joining us, and then we'll go from there. No, I hate it when Zoom does this, but anyway, um, we also have Undifaji Namacha, and please, if I mispronounce the name, please just when I give you the chance to talk, please just like pronounce it correctly for us. She's the policy manager for. Great, it works now. Uh, I'll come back to you, Undifaji. So we have Margaret Undisha with AI and digital health. Digital health specialist, working in the sector for almost 15 years now. She holds a degree in computer science from Kenyatta University, and she's also a taught and strategic leader for the digital health intervention programs at different organizations, including PAT, CDC Africa, CDC Kenya, HON, and the Ministry of Health in Kenya. It's a pleasure to have you, Margaret. Hi, Margaret.
Hi, I hope you can all see me and hear me.
I can
Yes.
see you clearly.
And thank you. You pronounced my name very beautifully.
Oh, I'm so glad.
Yeah, I'm Margaret Ndisha, and it's an honor to be here. It's afternoon for us here in Kenya. It's that like 16 p.m. So really excited to have this conversation. To talk about how we can really move from these policy documents that are very big in our PDFs, but not actually transforming into practice. So really looking forward to this discussion. Thank you.
Great. I love that you focused also on like how our policy documents are like, one of the beautiful, but we kind of find, lose ourselves in those policy documents and from action as well. And we have the lovely Undifaji Namache as well, who is the policy manager at Transform Health. Transform Health is a coalition of more than 200 organizations working on campaign, building consensus to strengthen and the digital landscape for digital health transformation to achieve universal health coverage. And she works closely with coalition partners as well in the delivery of a lot of these coalitions influencing work. Hi, Indifaje. How are you doing?
I'm good. Hi, everyone. I hope you can see me and hear me. I'm experiencing some internet interruptions, but nice to be here. Good afternoon, everyone from the warm heart of Africa, and looking forward to being a part of this conversation today. Thank you.
Thank you. And don't worry about network. I had issue with my screen as well, so it's fine. We'll just go along. This is really, I love that it's all women panels are really an opportunity to actually dissect these conversations that we're going to be having, and I'm looking forward to how this shapes out as well. And I'm Taofikat Adigu. I'm the policy officer for Digital Health Africa. I work across a lot of things. I work in digital health space, gender equity, and public health emergencies as well. So really, really, really happy to be hosting this conversation as well. And like I mentioned, I also have a bit of policy background, so I know how I understand the disconnect, especially with like policy work of having a lot of beautiful policy documents. Even when we do policy brief as well, we're actually summarizing 250 pages into 30 page perhaps, and no one is really reading it. Like, yeah, even when we're done with this policy as well, I probably don't read it too much as well. So yeah, it's great to see and dissect really how we can actually move from the policy that we have to practices. And also to put this into context, I think as of now, 46 African countries have the national digital health policies. And within those 46 national digital health policies, including maybe e-health strategies, only 16 countries actually have an updated policy from 2023 as well. So really, really, really something keen to actually talk about how even from these policies that we make or that we enact, from these policy documents that we write, really, really fancy things, how well does this trickle down to practices for communities, for women, for people of different diverse regions as well, especially with like the localized context we also have in our African region as well. So yeah, enough talking from me. We'll get into the conversation. And I have really just one question for all the panels now, and this is honestly to set the stage for our conversation. So really my question is, what does true health equity look like in the context of African health landscape? So if we're actually going to be an utopia world where everything is right, what does true health equity looks like? And I'm going for the first person on my screen, which is Margaret on this shot, to tell us what true health equity would look like for you.
So, well, I'd like to start just from how I understand it. CDC defines health equity. I like their simple definition as just fair and just opportunity for everyone, to attain their highest level of health. So what would that look like for Africa? There are many things that ideally most African countries are trying to do, and focusing on Kenya is implementing the universal health coverage so that at the very least, each and every patient from where they are can access service and quality service at that without becoming bankrupt, because we also know that healthcare is one of the very expensive services that we have in Africa. So while that's the big bucket, and that's good, I think we really want to make sure that healthcare is accessible and is not too expensive. For me, I think, and I truly believe that health equity will come if we have a patient-centered approach in everything we do, so that we empower the patient. At the very least, as a patient, when I show up at the hospital, I should know what does it mean for me to get good service, right? Most of the hospitals that we have in Africa have a service charter that says it should take you, 15 minutes at the registration desk. Most of our patients don't even know what that means. They don't look at the service charter. They just come in and come out. So while yes, the service might be available, they are not aware. So it's really to empower our patients. I'd like to maybe hone in into the fact that we are women. We're discussing, this in the International Women Month. I think for most men, by the time you're 35 and above, when you go to a hospital, as a man, you're asked, have you done your prostate cancer screening? These questions already start coming through. For women, most of the time, maybe they'll ask you about cervical cancer and breast cancer. But we all know that from 35 years and above, you're very much on your journey to menopause. And there are many challenges that come with that. So being health equity to me is wellness all around, right? So as a woman, I should be able to be asked questions around, how is your mental health? How are you feeling? But I can only know that those are questions that I should be asked if I am empowered. So just having a very patient-centered approach so that a patient is empowered, the healthcare worker is also empowered to know that there are some things they should be asking at. So a woman that they're supposedly not asking a man, so that the woman can get holistic care. So as that's to me, I just always think around, if my mother or myself, if I'm empowered, how would that look like for me? And how then do we make sure that this is cascaded across the globe for African women to be empowered, for even just the men to know this is what I should be getting when I go to a hospital. Then we can demand for better services, and we can start to reduce the gap that we have. Yeah. Thanks.
Thank you so much. That was really, really great. I love that you focus so much on empowerment, and empowerment is such a big word. And also to contextualize that in terms of like actually having people know their rights, empowered to actually ask for these things is actually one of the key things that we also need to like really work on, especially in African continent. That's really great. Thank you for sharing as well. Indifaji, what would true equity look like for you?
All right, hi. Apologies, I'm having interrupted internet. The site there's a blackout, which I think it goes back to these conversations. Equity means every sector in the country covered with electricity. So, like I said, I work with Transform Earth, which is a coalition of over 200 organizations that advocate, campaign, and build consensus around the need to create an enabling environment for digital health transformation to achieve universal health coverage. So at Transform Earth, to deliver on this goal, we recognize the importance of being intentional about our approach on gender digital health. And for me, as we're looking through what does health equity in Africa mean, I think health equity in Africa means that all individuals, regardless of their gender, their socioeconomic status, or geographic location, have equal access to healthcare, digital health innovations, and decision-making power in their health systems. True health equity will require addressing the existing systemic barriers that disproportionately affect women and girls and marginalized communities in Africa. The true health equity in this case requires closing the gender digital gap and ensuring that women and girls have access to affordable connectivity, digital literacy, training, and gender responsive health innovations. True health equity in Africa will mean that embedding gender equity in digital health policies to ensure that women needs are prioritized, but also increasing the representation of women in leadership. I mean, we've just had a beautiful example about, Namibia. It's something that, the entire continent is looking at. We have countries where, as you know, 70% of the health workforce are actually women, but women underrepresented in the leadership position. So we need to go beyond having women leadership tokenism, but actually giving women decision-making roles. So that's what health equity looks like for me in the African context. Thank you.
Thank you. You went all over to actually give us this contextual knowledge, and I heard closing the digital gender gap. I heard about the affordability in healthcare, the access, and also the leadership part of it. And yes, this is really what true health equity should look like, ideally as well. Tell me why you're next in line. What does true health equity look like for you as well?
All right, thank you so much, Taffy. I first off want to applaud Margaret and Indifaji. I think that they have spoken well to the theme in itself. Just to bring it full circle, I would say that to highlight the magnitude of our need for health equity and strengthen health systems, very often I lead with the example of the current state of our health workforce. That is, in Africa specifically, on average, our doctor-patient ratio is about 2.6 to 10,000, which is way below the WHO recommended standards, right? And although we're seeing now that digital technologies are actually making strides to strengthen health systems and bridge that gap in access and increase the level of care to provide equitable health care, we still face that hydra-headed bane of healthcare disparities, like across the social, commercial, ethical, and digital determinants of health, which Indifaji had highlighted a few, right? So just to summarize, for me, I would say that health equity within the African healthcare landscape would mean that we're advocating for health for all, for women, for young people, even for the men as well, by essentially addressing and eliminating disparities across the social, commercial, ethical, and digital determinants of health, thereby just ensuring that this level of commitment leaves no one behind. That is, no one is left behind at the end of the day, and everyone has equitable access to quality of healthcare and opportunities for well-being. So yes, that would be my definition of health equity. So thank you, Tafi, over to you.
Thanks, Tomiwa. And honestly, I think you guys should, if you haven't already, you should be the Ministry of Health for your respective countries because really your true health equity answers and context really puts it into mind what we should actually be doing, especially from empowered stage to access to affordability to looking at the social determinants and to actually bringing it forward to what Tomiwa talked about, particularly regarding closing that gap and also making this health for all achievable for not just women, for young people, for men, for everyone. So yes, thank you so much for all those brilliant answers. I think this really sets the tone and stage for us to actually move into this really deep dive conversations on actually moving from policies to practices. So yeah, my question goes to Indisha now. And the question is, how can we ensure that health policies prioritize inclusivity? So really not just in drafting policy brief, like I mentioned, but actually in implementation. And I know you've touched a bit on this in terms of like actually having people being empowered, but I'm also curious if you also have specific examples of how health policies in general can actually prioritize inclusivity in the way it's being practiced all over Africa or perhaps in Kenya context.
Yeah, and I think we should be very ready for anytime I talk to just hear about the way we need to include community and empower patients. I think I'm really passionate about that. But yeah, so how can we have equity and inclusion in as we draft our policies? Again, it's just to make sure that we have the right people on the table. Because when you're developing policy for me without me, then most of the time you miss the point. Most of the policy documents are, lack of a better word, copy paste from our West colleagues. And they miss the mark with the local context. They miss the mark with what we really need for Kenya or we need for Africa. And so we copy paste something when it's down to implementation, the person looking at the document cannot even relate to this document. So one of the major issues I think that we have to make sure we prioritize is having the right people in the room. The healthcare workers will end up doing the actual service delivery. Are they part of the policy discussions and policy documents? And then once we develop these documents, how are they disseminated? As we said when we were starting, jokingly at that, but still a big PDF that is 114 pages, perhaps, like our digital health strategy, is very hard to have somebody sit and read. And most of the time, not all the areas really resonate with them. So they want to go to a specific part of the policy and say, oh, what does it say when I'm, I don't know, registering a patient? How do I know, how do I identify those patients? How do I, ask for the different consent that I need to do to access their personally identifiable information. Those very sensitive things that, yes, are in the policy document, but very hard to find because it's all over, in a whole big document. So having a better way to disseminate, I think, is important, so that we have simple, summaries, perhaps booklets that somebody can just quickly look and say, I think this is what this policy means for me. And this is then how I would translate it to my patient who's living with HIV, or to my patient who has TB, and I need to send them from one place to another. You're referring a patient, how do you move the patient data with them, so that they don't feel, a certain way, they feel included, they feel like this service is also for me. So I think for the two things I would mention, and before I go to my next passionate thing, is make sure you have the people you're making the policy for with you, so that you're not developing policy that is missing the local context, is missing the mark. Ensure the dissemination is well done. Everybody should be able to read this document and actually get what they need to do to implement that document. And lastly, I think, is really to strengthen health information systems. At the end of the day, we need data to be able to guide the policies. So if we want to say that this policy is inclusive, this policy is equitable, how did we get there? What made us determine that this is a good policy? Did we have data? Africa data for Africa policy, not data that we collected from some other system that is not African. So strengthening HIS, I think, is very key, so that we can collect patient level data that, of course, is de-identified but can be used to determine policies. Data-driven policies, I think, are the best way to go, so that we're informed as we make our policies. Yeah.
Thank you, Margaret. That was so fulfilling answers. And I'm just going to pick up on some of the really brilliant point that you raised about actually having policies with people. Because really, when you look at this policy document, it says policy document for so and so, but really, where's the wheat? Along that line, what actually these people making those policies? Are we just having fancy policy workshops, sharing surveys house, and then we say, oh, 150 people has filled these surveys, and so this is what we're basing our policy writing on, bringing in policy analysts from, West, or even within ourselves as well, to just write fancy documents. So really, it's great to conceptualize all of these in terms of like, what was in the room to design these policies, what data are we actually using to report on these policies, and how are we actually simplifying the languages as well for these policies. And I think this leads me to another great question. And this is for Indifaji, actually. And I know you do excellent work with Transform Health, and you also have a recent publication on, I think, Gender Digital Foundation. And so I'm curious, this policy brief is actually great, by the way. It's not bulky, it's really lightweight. But
Yeah.
it has lots of fancy pictures, and it's really colorful, which is great.
Thank you.
Anyway, so that policy, I've read it, and so it really highlights gender analysis in digital health policies. So I'm curious, how can policymakers actually integrate gender indicators and participatory approaches into national strategies to actually ensure not just equitable access, but also outcome of these policies at the end of the day?
Oh, thank you very much for the question. I would say that I think my response is going to be basically a repetition of what Margaret has said, because I think it's very important for policymakers to be data-driven, inclusive, equitable, but also to follow an equitable, focused approach. And just to highlight what Margaret was saying, nothing for Africa without Africa. And the same way, when we're looking at it from the gender perspective, let us involve women in co-creating these policies. You cannot have an abortion bill that women are not even involved in the discussions around that bill. So it is very important for policymakers to involve women and marginalized communities in the co-creation policies. But also policymakers need to define and track gender disaggregated indicators. So, we need to move away from generalized data collection, but, go for a disaggregation data approach, looking at the percentage of women and marginalized communities that have access to mobile health services. Because usually when we're rolling out these services, we may look at them as a success, but how many women are actually, being reached with the services? There was a study that was done actually, I've just forgotten the country, but they were looking at the use of, M-Health for sexual reproductive health services and family planning services. And they realized that although these were women initiatives or services for women, it was actually men that were accessing the services. So it is important that for us to have data that's segregated, for us to know how impactful the policies we are implementing are, but also looking at the percentage of women in leadership, how many women are actually being represented at the table. It's also important to embed gender analysis in digital health design by conducting gender impact assessments, evaluating digital health tools, and how these are being implemented. I think Health Enabled is doing great work around this in Ethiopia, where they're looking at a gender approach to the research that is being implemented. But also the health policies need to reflect the lived experience of those that are affected. It's one thing to have policies, but for them to actually be implementable, they need to reflect the lived experiences in the communities where we're implementing this. I think Margaret really highlighted that really well, that we need to contextualize these policies. We should not just import policies from elsewhere and bring them to be implemented in Africa. But also lastly, I think it's important for us to invest in gender equitable digital health infrastructure and training. So expanding low-cost internet and mobile health solutions to those that are, unreached. And, as we've seen a lot of different studies that have been done by GSMA, women remain underrepresented. Their usage remains low in the use of mobile phones and internet. So let's take a more progressive and intentional approach in increasing access to women. Thank you.
That's really great. Yeah, I love all the brilliant point that you raised, and I'm just going to pick up on a lot of the points, but just one thing on gender disaggregation as well. I think sometimes we look at women from this homogeneous circle, like women represent different spectrums. Like we're looking at young women, even women with disabilities, women in the community, and I think Ndifaji and Margaret actually raised brilliant points on how we actually disaggregate this data, how we factor all of these women lived experience rather than putting all of them into buckets into the same group. How can we actually put them into different buckets and actually build a digital infrastructure? Thank you so much. That was I had a lot to take in from that, and that leads me to Tommy as well. And so, like I said, women are not just an homogeneous group. There's a lot of diversity even within being a woman. And so that leads me to asking you, how can young people and community advocates shape national and regional health policies for greater equity? I know we speak of policymakers, but what are these policymakers and how can we actually also be, policy impacting, policy making for ourselves as young people and as community advocates?
Thank you so much, Taufi. I think I'll start by saying that young people, even as community advocates, hold very invaluable insights and, of course, energy that is super essential for creating equitable health policies. But one thing we've found is the fact that, irrespective of the fact that young people have strong voices, they are often sidelined or reduced to symbolic participation, really. And so I think that to truly advance health equity, it's important that we actually begin to break down barriers that exclude young people from governance structures and decision-making processes. And I think that this would require institutionalizing youth representation within policymaking bodies, building their capacity in advocacy as well, digital literacy and civic engagement, and also providing young people with the tools to meaningfully influence policies. Right. I'll give a few examples of organizations and initiatives that are championing the inclusion of young people in shaping policies across both the global and national levels. Now, I serve as a consultant with the Digital Transformations for Health Lab, And DTH Lab essentially currently underscores the digital divides, that digital divides, limited literacy, and weak civic participation actually hinders young people's ability to co-create solutions for a healthier digital future. And now bringing these three domains together, DTH Lab has a framework that's an initiative called Digital Citizenship for Health. And it's a framework that ensures that through the pursuit of governance approaches and increase in health equity, they're able to enfranchise communities and advance public participation in health well-being, particularly among young people. So essentially, the Digital Citizenship for Health initiative brings together the three domains of digital, civic, and health literacy to empower young people to basically take control of their health and also take part in governance structures and decision-making processes. I think another organization that I would like to highlight is the WHO Youth Council as well. I know that this is more on a global level. However, the WHO Youth Council, as of last year, 2024, released the launch of the Youth Declaration on Creating Healthy Societies in Berlin. Now, this Youth Declaration was created by young people across different segments of the WHO, the 6 WHO locations, that is the zones. And the declaration essentially outlines 10 calls to action across 3 priority areas, which include health education and literacy, accessible and sustainable healthcare, and youth leadership and engagement. And so one of the ways I think young people can be involved in policymaking formulation processes is to run with these calls to action. That is the 10 calls to action that was launched by the WHO Youth Council, both on national and regional levels. Another initiative that I'd like to highlight is the Africa CDC Youth in Digital Health Network, which was launched last year at the Africa Health Tech Summit. And now this is a network of vibrant young people who have come together to empower African youth to essentially drive and shape digitally enabled, equitable and resilient health systems in Africa. I think Indifaj is on this call, so of course I would like to point out the independent think tank that is Transform Health's Young Experts Tech for Health, which is also a network of young people with representation across the 6 WHO regions, delivering projects that are driving health policy formulations, essentially. So you can see that even though there is the exclusion of young people within governance processes, we still find that a lot of networks are still being created to ensure that young people get the level of autonomy and agency to be actively involved in creating and co-creating solutions that foster digital health policies. But one thing that I know is that young people can actually actively influence policies by ensuring that their voices are amplified through advocacy and participating in policy formulation processes. Like Taufi mentioned, we have consultations going all the time. We also have policy dialogue forums and collaborations with network promoting value-based driven governance approaches. But essentially, one thing I would like to highlight is that while I do understand that young people can often be excluded from decision-making processes, it is important that we as young people don't just wait to be given a seat at the table. Rather, we must find ways to actually place ourselves there. So as young people within our national levels, regional levels, we have a lot of policies that have already been set out, a lot of calls to action that have been sent to technology companies, stakeholders and civil society, even the public and private sector. And so by virtue of also bringing into the place of ethics, holding our leaders and the legislation accountable for these policies is a call that I think can be placed on young people in a way that places our government accountable to all these policies that have been set out. So yes, over to you, Taufi. Thank you.
Thank you for giving the young people on the score an assignment, which is great. I really think you're absolutely right, especially considering a lot of great initiatives going on across the continent to actually promote digital arts, especially giving that young people that autonomy to actually advocate for digital art as well. And you can't advocate for what you don't know, or for what you perhaps don't even contextualize into your own realities and lived experiences. So I like that you highlighted the digital art citizenship and how that is going to cover a lot of civic literacy to actually engage young people to really know what to ask for, to know what to actually demand for as well, and to know how to track these policies and also incorporate it into your work. So thank you for those brilliant point. Yeah, we've talked about the gaps, we've talked about the what to do, and so I think we're going to the successful part. And yeah, we've criticized the policy to practice pathways and see the loopholes around it. So now I'm just going to ask Margaret a really nice question about the successful model. So really, as a digital health leader, especially someone who's so passionate about patients, about communities, what are really the successful models that you've seen for bridging the gap between policy and practice in digital health, and maybe around Toby, if you can mute people, that would be very helpful. Yeah, it could be around Kenya context or perhaps any other African context that you want to share.
Thank you for that question. And so, and I don't know if this can be called a model, but it's one of the successful projects that I have seen, and was very simply translating a policy into practice. So I like to think about it as if you think about product development, you have to have a way to prioritize what it is you're doing. So looking at the impact of your intervention, the reach of your intervention, and the effort it would take for that intervention to happen. So really having a guided framework on how you pick the interventions from your policy and translate them into practice. And so the model that I would like to talk about was solving one of the problems, was a project that was solving one of the problems that I think is widespread in Africa, identification of our patients. In Kenya, for example, we know that from age 0 to 18, we do not have national IDs. So children are very hard to identify when they come to hospital. And even over 18, once you get your ID, most of the people don't walk around with their IDs. They might know their ID number, but again, it's not something that is widely shared. Yet we had a policy right from 20 years ago that was requiring part of the demographic data that is being collected to include a reliable and correct ID number, so that we can be able to track our clients during referral or if they migrate from one place to another. So this policy it had been a discussion for a long time. How do we bring this identification problem, and how do we solve it? How do we bring our healthcare workers to actually accept that they need to ask for IDs? How do we educate our patients, to accept that they need to give IDs? And I believe most of these barriers were being broken down, but at the end of the day, we know that digital health includes people, systems, which is the technology, and then processes. So if you think about it, the processes were quote unquote there, the technology is available, and the people who were hard to manage, we were getting there. And the policy required that all these three are aligned. So how did we align that? And this is a successful model that I wanted to talk about. So we, and shout out to my boss that time, Dr. Kimanga, just thinking about how do we prioritize this? How do we bring this problem to solve? How do we solve this problem? Looking at, we already have electronic medical records that are in over 2,000 facilities. So already the technology is available. We already have APIs that can connect to the integrated population registration system that has information about everyone. Yet we are not able to correctly, document the IDs of our patients. So just coming up with a simple query window where we put in our ID number and query the what we call IPRS, the Integrated Population Registration System, and pull back information about this patient and save that patient's data. And quickly, I think in a matter of 3 months, we were able to break down this thing that we had been discussing for 20 years, a policy of how do we convince patients, how do we, without really seeing that the solution is right here with us. So I think, and that's why I was saying, I don't know if I can call this a model, but I'd like to think about it from a product thinking perspective, as because I am a product manager, is getting the simplest or easiest solution, and just looking at what is the impact of this simple thing that we are doing, what would be the reach, and then doing it and just getting it out there. So then we were able to have, I think, over 95% of our clients who are living with HIV actually having their ID numbers documented using this very simple way of thinking. So I think as much as possible, in whatever policies that we develop and the different interventions that we have in our policies, is just to look at what do we have in terms of our people, in terms of our systems, in terms of our processes, and what then can we quickly prioritize that has wider reach, that will require very little effort and just get it done. I think for me, I'm a believer of get it done, because once you do, you learn and you can then therefore improve. And again, the other thing I would talk about in terms of a successful model is just being flexible in your implementation as much as possible. So considering the work that is being done in Kenya and in many other countries around community health information systems. These systems are very, we have policies around preventive and promotive strategies, and those should be automated in terms of right from the household when the community health worker goes to see a patient. But again, this community health worker who's not a healthcare worker is expected to screen for TB, is expected to test for malaria, is expected to do so many things. So while this policy is sound, what then can technology, one of our 3 building blocks, support this person, the community healthcare worker, to be able to collect this information? So thinking about what other systems are in the ecosystem, can we then be flexible enough to have interoperability solutions that are just simple, so that once some checklist on TB has been collected, another system that can be able to quickly understand what is collected and give information picks up the data and and so on and so forth. So I've talked about 2 models. I don't know if they're models, but that's what I would say, is just being very guided in our prioritization, looking at our impact, our reach and effort, and then being very flexible, and especially knowing that we have technologies that we can adopt to quickly allow us to use the technologies we have to support the people that are working with those technologies. Thank you.
Thank you. Those are brilliant models. We actually need them documented, to be fair. I honestly think you raised brilliant points about having these solutions very simple, very easy, very interoperable in terms of how to pass information. Sometimes I honestly think we do a lot of like copy paste model of digital solutions, and then you're like, yeah, it's fancy, it's great, but really, do people understand how to use them? Are we able to get the quick information that we need from this system? So really, thank you for sharing all that model, especially around how easy, simple, intuitive digital health community health systems can actually be for people that it serves, the people that use them, and the people that are actually designing them as well. So I think it's a circle from the design stage to the implementation stage to the user stage as well. All of this has to really align. So thank you for sharing those as well. Speaking still on the successful model, my next question will go to Tomiwa, and I'll be asking, really, what are the community-driven digital health policy initiatives that you've seen, and can you share any to us as well?
Hi, Tafi, can you hear me?
Yes, I can.
All right. Thank you very much. So yes, thank you very much for that question. Um, uh, just so I'm clear, could you go over it again? Apologies.
Sure, no problem at all. I'm curious about the different community-driven policy initiatives that you've seen that actually works for people, especially in terms of like centering their experiences, bringing them together. I think you've actually touched on how a lot of these consultation work, but are there other successful models that you've seen in terms of like, it's not policymakers that are writing this policy, it's community that actually, drafting this policy. It might actually not even get to like the policy implementation stage, but really a community driven approach for that kind of shaping policies that you want.
Okay, thank you so much. I think that for me, specific to community-driven health initiatives and how these type of policies have, would I say, expanded across different regions and nationalities. I would say that specifically for that domain, it's important that we understand that we cannot create solutions for the people without the people. And so we've seen initiatives championed by private sectors, the public sector as well, that ensures that they prioritize the inclusion and co-creation approaches of the community members from the point of design, like you said, to implementation and monitoring and evaluation. I would give an example of an initiative that I worked with Farm Access, which had to do with the development of the health facility regulatory portal here in Nigeria. And that particular type of solution involved different levels of stakeholders, from the public sector to the private sector, that is from the tech companies who would be developing the software that is the solution, to the regulatory bodies that would also be adopting these solutions. So like you said, from the point of design to implementation, we had to ensure that we included them within the process to make sure that even though, as we iterated several processes, they were also there. That is, their perspectives, preferences, needs, and challenges were also taken into consideration. And yes, we deployed that particular solution across different states in the Southwest and also the northern part of Nigeria. Essentially, it's the health facility regulatory portal that, would I say, I'm trying to look for a simpler term so that would be easy for people to understand. That is ensuring that the process of regulation for healthcare facilities and also the transition from paper-based to electronic was done seamlessly. So yes, in that regard, given an example of one of the things that we have handled here in Nigeria is the development of health facility regulatory portals for both the public and also rather for the public sector specifically. We also have the health facility management agency, where we also made sure that the solution was utilized in a digitally innovative manner, that is transforming them from the point of paper-based to like I would say digital transformation, or rather digitization, the level of from paper-based to digitization. So yes, that's a few of the examples that I would like to give with regards to that. Thank you.
Thank you, Tomiwa. That's a brilliant one as well. And I like that you touched on the paper-based to digitalization-based, because a lot of conversations are around us fully leaving the paper-based system to digital-based system, because a lot of things can happen to paper, but digital systems have proven to be resilient and able to capture a lot of data informations that we need. So thank you for sharing that. I'm going to go to Indifaji now, and and in fact, with like a lot of mistrust, low digital literacy and limited infrastructures, sometimes can be a major hurdle for digital adoption among women and young girls. And so I'm curious, which policy levels or framework have you seen also that address these barriers at scales, especially across your work with Transform Health and a lot of coalition members?
Yeah, thank you very much for the question. I think most of the responses have already been given, by the previous speakers. I would like to look at it from a three-fold perspective. Mistrust in digital health stems from data privacy concerns. So from the research that we carried out at Transform Health when we're, developing the policy brief, we realized that a lot of women and girls do not trust the systems because they're not sure how their data is going to be used, but also because of issues of online gender-based violence that they experience. So in order for, for this to be tackled, first we need to have gender-responsive data governance frameworks. And I'm going to respond to this without looking at any countries in particular, but looking at the work that Transform Health has been championing around the development of a health data governance global framework, that's a step towards that direction. But also have community-led digital health models. So here we aim where, it's very important, and we've seen this working in different countries where, there are initiatives that are aiming to close the gap between the health systems and also underserved populations to build trust. But also, you asked me about low digital literacy. I think here it's important that, countries should adopt frameworks that are intentionally closing the digital literacy gap through gender responsive capacity building. Tomio gave an example earlier about, the youth demanding a seat at the table. And, as the youth are demanding a seat at the table, it's very important for them to have the right capacity for them to sit at the table. And this also applies to, women from a gender perspective. As much as we're advocating for women leadership, we also need to ensure that the women that are actually taking a seat at the table do have the right skill set to be able to represent and to speak for, for the general population. So having targeted digital literacy programs, we've seen this work in different countries, but also in incentivizing women, who take on developmental courses. I think we've seen different, programs and developmental partners taking the initiative of having, online programs that are free just to encourage participation from women. And, when we're looking at the limited infrastructure as a major hurdle for digital health adoption, this is very true. And, it also relates to the data that GSMA has, been talking about over the past years about mobile ownership and mobile access, but also internet access. So here, I think some of the policy frameworks or levers that work is governments to take an intentional approach in closing the gap to affordability in mobile devices, but also internet connectivity. We have seen, this work in different countries where there are women-centered digital hubs that are being opened that allow women to access digital health infrastructure or, just digital literacy skills at little or no cost at all, but also having gender equitable tech policies such as subsidized mobile devices. So I think if we can look at it from that threefold perspective, and developing the right policies and implementing and adopting policies that have worked in different countries, this will then help us to close the mistrust, low digital literacy, but also the limited infrastructure, which has, as you have rightly put it, remained a hurdle for digital health adoption amongst women and girls. Thank you.
Thank you, Defaji. And I honestly think you brought the right answers, especially across a lot of data governance and a lot of mistrust on digital health. There's this Flow app as well that it was a lot of data from women have been sold out. And so really, and then at that point I was looking at the iOS apps and trying to see, do we actually have Flow app of ours in different continent context of African continent? But we don't have that information around it. People are not using it as much as the popular one from the West, and also really bringing all of that contextualized realities into affordability of this programs, health literacy around it as well, sharing information so people can actually have access to this is a really brilliant one. Thank you so much. You guys have done really amazing, but we still have one last final round. And so yeah, if you want to take just 1 minute break, and then I'll jump over again to the next question. But this is the last audio, and you're doing brilliant so far. And so this is just a general question now around partnership and collaboration as well. So since Margaret has been starting, I'm going to leave Margaret to chill a bit and then move to Tomiwa this time around. And right, so with Tomiwa, the question is, what partnership or collaborations should we be looking at to actually ensure that digital health innovations and policies are scalable and sustainable? And also to also contextualize this, there's a lot of great things going on in different countries, but we don't have the centralized information that brings all of this together. And I think that's what we try to do with Digital Africa in terms of sharing knowledge, sharing practices that is working in different countries as well. And so really, what do you think we should be looking forward to in terms of like partnerships and collaborations to ensure all of these digital innovations are scalable?
All right, thank you so much, Talfi. I think that it's very important to note that much of the digital health innovations and capacity to strengthen health systems, also increase health equity, have been driven by the private sector in most countries, really, with some effort from the public sector. And so I would say that, however, to ensure sustainability and scalability, partnerships have to ensure that they take a multifaceted and strategic approach. That is collaborations between governments, civil society organizations, the private sector, even the academic institutions, also ensuring that the youth voices are heard through the youth-led initiatives is really essential. For the government, we know that government must ensure that they provide policy frameworks and investment in health through health spend and funding support, even understanding that even though health is wealth, wealth is also health, right? Through the private sector, we know that private sector offers a lot of technology expertise and resources within that domain. And with the civil society and youth-led initiative or rather youth-led groups, always bring that level of community insights and advocacy, as well as innovative perspectives, because to ensure an inclusive rights-based, that is an inclusive and human rights-based digital future, it's very important that the young people of this age are included and are involved as partners, not just beneficiaries, in co-creating these policies and these solutions, right? On our end here in Nigeria, one of the initiatives that is championing the scalability and sustainability of digital health innovations and promoting health equity is the Nigerian Digital Health Initiative. And it's like a coalition of partners across the public, private sectors that are essentially working to increase equitable healthcare here in Nigeria. So I would say that partnerships have to be very multifaceted. I know that book-wise, we always hear that, but implementation-wise, we cannot do, we can't actually make this impact and this transformation without each other. So it's like having, what I said, if the public sector or the private sector is taking charge in leading, if the private sector is taking charge in leading digital health innovations, we need the public sector to also adopt these initiatives or these innovations across the PHCs, which is the healthcare system that most women and in underserved communities use, right? So to ensure scalability, it has to take a coalition form of approach. And we need to also ensure that it's inclusive across board. So that's what I would say would ensure in terms of partnership and collaboration. It's very important that we look at coming together. We can't do it without, one can't do it without the other. So that would be my response to the question, Tafi. So thank you, and over to you.
Thank you, Tomiwa. And yes, as brilliant as always, especially in regards to how we need to work together. We can't do this without each other. And I also think like a lot of time we tend to do things in silos. So private sector wants to do theirs, public sector wants to do theirs. But really, it saves more time, energy, and investment to actually pull all of these resources together, especially if our people we want to do it for are actually the same people we are still doing it for. So like, why not bring all this investment together to actually make this work? So thank you for that brilliant answer. Margaret, I'm coming to you now. And so, yeah, speaking of partnerships again, in your opinion, what policy changes or investments regards to partnership are actually very urgent right now to close the health equity gap in Africa?
So can I answer that question in terms of just fast policy changes before I talk about partnerships? I think most of our policies, they purport to be data driven, and then for most of the awards that I've seen, there's always a data use component. But I for sure can say that we are not actually using our data, the Africa data, to inform our policies. And I'll give an example. We know the importance of immunization and immunizing our children, because they are immunization preventable diseases, and we want to make sure that those are either eliminated, eradicated, or reduced to a manageable number, so that it's not a public health concern or threat. But if you look around most African countries, none of the African countries, at least to the best of my knowledge, has a functional electronic immunization registry. Yet, most of these vaccines that are coming through, like the BCG vaccine for TB and the measles and things like that, are mostly used in Africa, but they're developed in the West. But there's no data there's no way to triangulate consumption data vis-a-vis development data. If perhaps there's adverse events that are happening, which should inform the policies that ministries of health are developing in terms of, at what weight or age should some vaccines be given? Should there be a change based on the data we've seen on adverse events for our children? All this information is not being collected. It is in some very big registers in our facilities, and really that should change. And it can't change. It can change with us. And I think, I hope and pray that as we continue to, to push for digital health in Africa, that African countries will adopt actual, implementation of these systems and use of the data for policy making. I think this is urgent, so that our policies are informed by data that we have collected as Africans. The other thing that, I think a lot about is, there's a lot of evolution of artificial intelligence, and technology is really moving very fast. And I always fear that the farthest is moving, it's actually as far as it is moving, it's also increasing the equity gap, because the West is moving very fast, and they have all this data that they are using to train their models. And the models are very Westernized, if I can put it that way, because once again, there are no African data set to train the chat GPTs, the llamas, the things like, so at least when I query chat GPT, I can get like an African context answer. So just to talk about, the kind of partnerships that we are seeing and successful at that. At Path, I know there's partnerships happening with different companies and private companies at that, in Nigeria, in Rwanda, and also with academia in Kenya as well, so that we can start to create African data sets that can be used. So we are evaluating ChatGPT, we are evaluating Gemini against an African data set to ask, okay, so is ChatGPT understanding the African context? And so what should be changed, so that we can inform the next policies that are made, so that we don't continue having a big divide which is getting even bigger as the technologies are moving forward. So I think I would say that this is one of the things that we must do, continue to partner with private sectors private companies that are doing amazing things in artificial intelligence, that are very, very useful now in the health sector, that ministries of health and implementing partners can work together, as we do, as is happening at PATH. So those are the two that I would mention. Thank you.
Thank you so much. And I love that you brought the artificial intelligence context into play, because sometimes I say, like, we're actually far behind, and if we're not careful, we'll still remain far behind, because a lot of time conversation has scaled up beyond, what we're talking about, digital literacy and all. Like, people are talking about the next, artificial intelligence, tech AI and all. So yes, we really need to work harder and faster to actually meet up this landscape shifts as well. My next and final question goes to Undufaji. And this is really, if you had to pick one policy priority, and I know this might be hard since we work with a lot of policy priorities, but just one to fast track gender equitable digital health, what would it be? I know it's hard, but one, we're out of time, so just one.
That is a very difficult question. If I had to pick one, I think, wow, that would be around her data governance. I think if there was a policy that I'd have to pick as one that will fast track the gender equitable digital health transformation would be health data governance, because data is the foundation for digital health. When data is weak or is gender blind, it's going to continue to reinforce the inequalities in gender. So women and girls and marginalized community, of course, they remain invisible in the data sets, and they face higher risks of data misuse, privacy violations, and digital exclusions. As Margaret was sharing about AI and how Africa will continue to remain behind, I think a lot of the AI innovations and even a lot of digital tech innovations are actually developed with the man in mind. There's never the woman in mind. And if we continue to be, gender blind in our data, I think this is going to continue to weaken and continue to widen the inequalities. So if I had to choose one policy, it would be around data governance. So, strengthening the legislation and regulation to govern data, to protect people, promoting health value, but also to prioritize equity. So that would be my pick.
Thank you. And just so you know, I knew you were going to pick digital governance. And really, to put it into context, like without data, you can actually build a lot of like the digital health solutions. Even policies rely on data to actually inform digital health. So that was a great answer. Well done for picking that.
Thank you.
Oh yeah, we finally come to the panelists sharing their brilliant answers, brilliant thoughts on this really insightful policy and practices, and how we can close the equity gap. So we just take 2 to 3 questions. I don't know if we have questions in the chat, but really, yeah, if we have any questions, you can just raise hand and then we'll allow you to speak. I think just 3 because of time, and we still have to do the IWD award as well. So if we have questions, I'm just trying to read the chat. Oh, someone said most policies are predatory or plain absurd as an healthcare practitioner. If I wanted to get into policy making, how can I be involved in policy making? That's a good question. Who's ready to take that? Who's the policy? Let me see. The person next to my screen is the person I'm picking. And yeah, it's Indifaji.
Oh, wow, that's a very good one. Because I do come from a medical background as well. I'm a medical doctor by training. And, my journey really started when I was in med school, and I call it my Damascus moment. When I was in the rural parts of Malawi, and there was a woman that walked into the HIV clinic with a 5-year-old and another child, and she basically said, to cut the long story short, she basically said this little one was tested HIV positive months ago, but I'm not going to give my child ARTs because I think you got it wrong, and the clinician, and I'm just a student, they're like, no, mom, we've got a very long line outside, you need to start taking the medications, and at that point I started to look at, okay, when we're developing this ART policies and treatment, we really do focus on the bedside and the clinical component of it, but never really look at the socioeconomic factors that affect, these people, and that will enable them to actually be compliant to the drugs that were given. So that was my Damascus moment, to move from the bedside to be on the other side of clinical practice. So I would say that if if you're in the clinical side of life and you're looking at how do you get into policy, I always say that what causes your heart to tick? What causes your heart to tick is what you're going to advocate for more with a passion, because you know that this is where my heart is and you're going to want to drive change. So if you want to get into policy, I think the first question would be, what's your Damascus moment and what causes your heart to tick? And that's where you probably will be able to influence change. That's what I can say.
Thank you so much for that answer. And yes, that's honestly the right path, because if you follow the usual path of like just being a policy analyst, you're just going to be, getting into the system. You're also like part of the problem, I might say, because you join the system and then you start writing really good policy documents that are actually not actionable. So really just really finding that focus. And it could even start from critiquing policies, from analyzing policies, monitoring, evaluation, whatever country you're from, the policy document, go read it, action out one area, speak about it. And from there, you're able to like build your experiences in policy analyzing to policy shaping. I see Chidima's hand is up. Chidima, are you able to speak?
Hi, good afternoon, everyone. I wanted to get the opinion of all the speakers actually. So, I'm a medical student and I have interest in health system strengthening, not just like health policies. And going through the speaker's profile, I recognize that each one of them has, in one way or the other, like had experience in health system strengthening. So let's ask, as a medical student in Nigeria, what do you advise? Like, what are the different paths? I would like if each speaker could talk. What are the different paths that a medical student could go through to build experience in health system strengthening while still in school?
That's a really good question. And I think you have a preference for who to answer your question. Look at you. What do you want to answer your question again? I think I heard you say.
Oh no, I would like an opinion from everyone because I know everyone has different experience from different countries, different workplaces too. So I'd like everyone's opinion.
Okay, but unfortunately, due to time, we'll probably just have only one person answer briefly, and because I see like there's other questions in the chat that we probably might not be able to answer, as we need to move to the next stage. But yeah, I don't know if Tomiwa is still on the call. I think she mentioned leaving soon. Margaret, do you want to answer that question on how they can get involved in to?
I don't have a very good context on Nigeria, so I think Tomiwa would have been the best ones. I don't know if we still have her on the call.
Yeah.
I'm still on the call. Hello,
Oh,
everyone.
great.
So yes, thank you. I think that was Chidima's hand that was up. But I would say that I can only speak from my own experience, right? And one thing that I would point out in Nigeria, in fact in Africa general, is that we live in a very competitive world. And I think for me, one of the reasons why I delved into digital health was because I wanted something that I could wake up to and be excited to speak about. And that was how I toed the line during my master's thesis. But essentially for a medical student, I would say volunteering. I know that it might sound a little bit cliche, but that was essentially how I began in my field in digital health. So looking out for digital health companies and organizations where you are at to volunteer with, just to gain the necessary technical skills, and also in terms of stakeholder management, project management, product development, and the likes. I mean, the list goes on and on because the digital health space is super vast. So you have to know where you want to go into. Is it in terms of policy? Is it in terms of product design and development, and the likes, right? Or stakeholder management or project management. So one of the things that I experienced handling certain projects with Farm Access Foundation was the interconnected play between several industries, because you had the software development team. There was a time we developed an online health information platform. We had to employ, or rather gain the expertise of medical doctors. And so we had to reach out to the Nigerian Medical Association for ethical approval, just to gain doctors to provide African-based content. That is content for Africans by Africans, to develop that online information platform. And so if you were still in play, I mean, there are other organizations that I'm sure that would still be championing this. It's an initiative that you can obviously definitely partner with, just to add in your inputs as a medical doctor in the form of content writing, right? So I would say not to take everyone's time, ensuring that you volunteer with organizations that are championing digital health innovations would definitely be there to help you to scale and also help you figure out where you want to delve into, right? You have Digital Health Africa here. I'm sure that, I don't know if there are volunteering or internship opportunities open. You have organizations like Farm Access, you have the Nigeria Health Watch in Nigeria, and there's the different angles with digital health. You have the communication side, like I said, it's a very, very broad spectrum. So you have to know for a fact that what do you want to delve into, if it's product design, if it is stakeholder management, if it is project management, if it's in terms of policy, and data is also gaining really interesting traction now if in terms of research. So if it's that field you want to go into, it's important that you look out for these organizations within the country or even outside, really, that you can partner with and join youth networks. They're always vast opportunities that are being released. There's opportunities for youth. You can gain internship opportunities with certain, would I say, openings that are posted within their network. So yes, we also have Transform Health, like I've said before. We also have the Digital Transformations for Health Lab. We had a call for research fellows that has recently closed, and we needed young people who are in the research place, who are medical students interested in digital disruption, to manage that. So again, just bringing this full circle, look out for opportunities within the space and also learn to look out for volunteering opportunities as well. Another thing is looking out for the organizations that you would like to work with and give them a short shout out, or rather code mail them, like they say. You never know, you might just get into one of them and start off your career, or would I say your trajectory from that point. So yes, I hope that I've been able to answer your question in that wise. So thank you very much.
Thank you, Tomiwa. You just gave a paid masterclass for free, because this is literally what people pay for to get knowledge. And yes, I won't even say anything more because I think you've answered it all. And even for me as well, the way I moved to digital health practice was through research and policy analysis as well. So Tomiwa is actually giving you all the context that you need. You just need to do your own research as well and factor in your own interest and your own experience as well into whatever area you want to go into. I don't think we can take any questions anymore, so sorry. But I did see one thing said women always have the easiest solution to a desk problem. Bravo. And I think that this is all for our panelists in terms of how you guys were able to like distill all the questions and really, really being specific about the solutions that we actually need. So thank you again for all of the brilliant answers. You guys should go for the Ministry of Health in your respective countries as well. We'll vote you in. And yeah, moving on to the next stage. As I'm so sorry we can't take any questions, but you can actually put your questions in the chat, and if we're able to, we'll probably provide answers on LinkedIn, for example. I'm also planning on writing an article excerpts from this as well to put your questions into the limelight. But I did see really one important questions here about policies, and I think I might just answer that. Said, are policies made on the continental level? If yes, what's the work done behind the scenes to avoid one size fits all policies, knowing the continent is 54 countries with different realities? This is a really good question. Policies are made on different levels. It could be from a national level, from a regional level. The African CDC is really involved with a lot of like the digital health transformation continental level. But I think for like the continental level with the African CDC, they just bring this policy not they don't distill the policy per region, but they just bring in what should transformation look like. They provide a yardstick guide for people to now go, especially for like people from different regions to actually now go, like using the African CDC digital transformation landscape. This is what we think fits into our context, into our own realities. And then each countries also have their own digital strategies. Nigeria has, for example, Kenya as well has. So yeah, like there's different ways to look at policies from both regional level and from both national level as well. So yeah, moving on now to the IWD award, which is the exciting bit. The panel was exciting as well, but this is another exciting bit. I think Vivian is sharing a screen now. Vivian, are you able to share the next slide or watch a really fancy video and celebrates women doing great work in the digital art spaces through their different actions? And like someone say, women are achievers. We achieve, we're brilliant, we do amazing things. So it's just really nice to showcase all the brilliant work that we do. I'm just trying to let. Hi, Vivian. Are we able to see the video that we made? I think I should perhaps try and share my screen again. So yes, we started this in 2024 where we awarded 15 African women doing amazing work in digital health. And yeah, those are like the brilliant and lovely women doing this amazing work. Like I said, there's a lot of work going on the continent. Women are either championing them, and we just selected 15 women at a time. And for 2025, I wish Zoom had a drum roll kind of beat. I was going to play drum roll. So we have 25 African women in digital health and 25 awardees here now. And we have a really lovely video that puts all the work they do into context as well. I'm just going to take the hosting. For some reason, the video. I think I'll try and share from my end. I don't really have permission to view the video, so. Okay. Hi, are you able to share the video from your end again? I just think. And yes, a recording of this would be shared as well. I see a question on the group asking, the chat asking if the video would be shared. And Udifaji also dropped a comment as well saying volunteering also worked for her as a medical student. So yes, volunteering really is the way. Volunteering, research and writing really is the way to move to this stage as well. I'll try to share the video again and see if it worked. Okay, great. Can we all see the video? Maybe just by a reaction, if you can see and hear. Great, thank you, Tomoa. So those are the lovely people that we're actually presenting this award to today. We have Gifty doing great work as well. And the beautiful part about this is actually from different African country as well. So people. Yeah, congratulations to everyone. Like I said, women all over Africa are such an high achiever, especially with like a lot of barriers that we experience, a lot of like the digital gender gap. We're still actually making things work for ourselves, for other women. So it's really such a delight to actually what this incredible women were actually doing amazing things all over the continent. And as a core as well, sometimes we really label the problem, but how can you be part of the solution? And those people have actually said, you know what, we see this problem, we agree to this problem, but we're actually going to be part of the solution by doing our own small parts or big parts in this as well to make the world a better place for not just me, but for other women as well. So I will call on two people who are on the call to just maybe say a few words about their work, and then yes, we would. So I'm going to call Farida Ibidun. Are you on the call?
Yes, I am on call.
Hi, Farida. Congratulations. How does it feel?
Hi, thank you so much. It feels, what's the feeling? Mm, I'm happy, I'm excited that the work I'm doing in the space of digital health is being recognized. And that is a very significant milestone to me in my journey in digital health. So yeah, I say thank you so much to Digital Health Africa for this achievement. And I'm also saying thank you to everybody on this call and to the panelist section. That was such an insightful one. Thank you so much, everybody, for this opportunity.
Thank you so much. And yes, I think it's really important to actually celebrate the brilliant work that women are doing as well. So yeah, congratulations. Keep up the good work. And yeah, I think because of time, we'll probably just have Farida speak. But really, congratulations to everyone. We will be celebrating you all over LinkedIn, on social media as well, and also sending you awards. So yeah, and really just keep up the great work. And in whatever way you think Digital of Africa or any of the organizations from the panelists could support your work as well. A big shout out, let us know. And I think that reminds me of what Chidima question asked about, like how can they be in this space. So if you need people to volunteer for you to work to make sure the work you're doing is being more amplified, give us a shout as well. So really, thank you so much. I've had a great conversation. I've a lot of things. My notes is quite full with a lot of ideas, and like I said, every time I'm in this kind of space, I'm really just not looking at the problem. I'm looking at the solution as well. There's going to be a lot of problem all the time, but really, how can we be part of that solution? How can we work hand in hand? There's a lot of talent out there. There's a lot of skills. How can we shift the conversation from talking about the problem to actually acting on the solution and figuring out as we go? So this was a really good conversation in terms of like policies, great. Let's enact policies. That's brilliant. But really, let's move from policies as well to practices, and let's amplify action to closing the gender digital gap. Because if not now, then when? Like this is 2025. There's conversations that we probably should not be having now, but we're still having it. So we really need to be more mindful about how we progress with our solution. So thank you for joining, Tam. A brilliant thank you to our panelists again, from Tomiwa to Indifaji to Margaret, to all of the brilliant nuggets that you guys have shared in terms of how to engage and how to move from policy to practices. Yeah, it was such a wonderful time hosting this event with you and getting to know all the questions. Thank you again for Digital Health Africa for organizing this. I know it took a lot of effort, and thank you to Vivian as well. Thank you to Innovate Health Africa that we partnered with as well, and to all of the brilliant 25 women who were awarded the Digital Health Africa Award for 2025. Thank you for being a part of that success story and putting the work in there and out as well. So yeah, I think we've come to the end. This was such a long webinar, but I hope it was enjoyable for you, and you're actually moving out of here to a quality action. There's one takeaway you're taking out of this is really being part of that solution, and doing your own parts in digital art space and in closing that gender gap. Thank you guys, and have a lovely rest of the day. Yeah, I can see comments saying, thank you, DHA, for the award. We keep inspiring. It's humbling and also great to accept this award.
Thank you so much, DHA.
You're welcome. If you're not following us on social media, you should be following us on LinkedIn, Twitter, because we post a lot of opportunities, whether that's digital health news, whether that's like digital health opportunities that you can be engaged with. So yes, give us a follow as well.